Lunars, the blood pushes up into the great vessels, and then it builds pressure and then snaps those semilunars shut. And that's the dove sound, so the semilunar valves closing. So it literally, the cardiac cycle, the sounds that we can measure and track are coming from AV valves and semilunar valves closing. Okay? And we can measure all that. So here's, I just put it in here, is AV valves, the tricuspid or mitral valve, and then bicuspid, that's the lub, they snap shut, lub, and then the semilunar snap shut, dove. We can hear various heart murmurs. You can even pick up by heart sounds. You can do an EKG trace where you track the electrical rhythm of the heart, and you can also listen to the actual heart rate. Sometimes you can clearly hear heart murmurs or problems with valves because we know that they make those distinct sounds in that fashion and in that rhythm. All right, so the blood supply to the heart is really important. We talked a little bit about this. Keeping the heart getting perfused with blood and oxygen is really important. So there's coronary arteries. They arise from the aorta. They're located in the coronary sulcus. We looked at this at the beginning of this lecture series. The main branches are the left and right coronary arteries. They wrap around. They come to the front of the heart. And then you have that, remember that interventricular anterior artery that goes down in that coronary, in the groove, or that anterior interventricular sulcus goes right here. So we have the left coronary artery, the right coronary artery, okay, and then they wrap down, they go along the front aspect or anterior part of the heart. So anterior interventricular artery comes from that, originally from that left coronary artery. Also veins as well, and this is looking at basically the flow of veins is very similar, very parallel to the actual coronary arteries of the heart. So there's a lot of disorders now, and we mentioned this, we were talking about regeneration capability of the heart, or its limited ability to regenerate. There's a lot of diseases that affect the heart. Coronary artery disease, atherosclerosis is a great example of this, one of this common specific in this category of coronary artery disease. It's due to cholesterol and fatty buildup, fat deposits that accumulate in the walls of the arteries. And really it's kind of an inflammatory response. The body and the circulatory system attempts to fix a problem. Often if there's too much fat, too much especially like saturated fat, trans unsaturated fat, cholesterol, all those things, and if there's a problem with any of the blood vessels or capillaries, with high blood pressure, with unhealthy diet, if there's any nicks or damage to any of the vessel walls, there's a tendency of those fats to accumulate and deposit there. And then other cells like macrophages and white blood cells and platelets to aggregate and sort of plug up or try to fix that area. And it causes that area to build up a plaque or a fatty deposit that gets bigger and bigger and bigger over time. So it's like the body is trying to fix a problem. It's almost an inflammatory response. And it starts to get packed with fat and cholesterol, white blood cells, platelets, and becomes really dangerous. So this can actually lead to, and is really closely correlated with myocardial infarction and heart attacks. Clogged coronary arteries. They're getting fatty deposits and they get occluded or blocked over time. And actually this development, it begins as early as like 10 years old. So after this first decade of life, what you eat, your diet, your lifestyle, all those things start contributing to these, and these can build up, these little fatty deposits can build up over decades. And then lead to something like a heart attack in the 40s, 50s, or 60s, or 70s. Women experience it later than men. Angina pectoris is just chest pain. And a lot of times that can be indicative of ischemia, so lack of oxygen getting to certain places in the heart. Sometimes it's benign and it doesn't lead to anything serious. Other times it's an early warning sign. A myocardial infarction, or an MI, as people will just abbreviate it, it's a blocked coronary artery. So we talked about the right and left coronary artery and the anterior interventricular artery. Oftentimes those or branches of those will get blocked, okay? And usually atherosclerosis or fatty deposits like that have been accumulating are the cause, and that's what we call heart attack. Silent ischemia, that's no pain or warning, and then there's a lack of blood and oxygen to a certain area of the heart. And that can be really dangerous as well, because there's absolutely no warning, it just happens, and there's no pain that comes right before it. Okay, there's also heart failure, progressive weakening of the heart. Really, the heart can't meet the body's demands for oxygenated blood, so the heart is not efficient enough in getting oxygen and nutrients out to the blood. Now you might think heart failure means the heart is so crippled that it's falling apart and it's a heart attack basically. This is not a heart attack. Heart failure is a category of heart diseases where the heart is not working well enough to meet the body's demands. That's it. It doesn't mean it's a heart attack. It can lead to further things down the line, but in general, it's just a progressive weakening of a diseased heart. So it's going to get worse and worse and worse if things aren't fixed, medicated, changed, and all of that. So one aspect of this we call congestive heart failure. This is a type. This is a type of heart failure where the heart enlarges and there's fluid buildup in the body. So this means over time, the heart's capacity or efficiency for getting blood to itself and to the rest of the body has become so diminished that there's now pressure and fluid building up in certain parts of the body. It can build up in the lungs or it can build up out in the fluid, out in the tissues. So the heart is causing sort of a backup or a fluid buildup, edema in the body. Pumping efficiency, of course, of the heart declines, and then it gets even harder for the heart to meet the body's demands. And the heart is enlarging, it's kind of interesting, it hypertrophies. So the heart's efficiency is going down, and it's almost a compensatory effect to get bigger and sort of have bigger mass and bigger tissue to kind of work against it and get blood out and oxygen out to the body, but actually enlarging makes it inefficient. It gets less efficient. So usually an enlarged heart, that's indicative of congestive heart failure. The heart intrinsically is trying to kind of work against the problem, but it actually makes it worse. Having a large, clunky sort of heart, and it's not now able to be as efficient. It's hard to know what's the cause and what's the effect, but it typically happens and it accumulates altogether. It enlarges, you get edema, and the pumping efficiency even further declines with CHF or congestive heart failure. There's also pulmonary arterial hypertension. So arteries of the lungs get high pressure or blood pressure, hypertension. And this is enlargement and potential failure of the right ventricle. So if we look at the right ventricle, why the right ventricle? Why would the right ventricle enlarge or hypertrophy and be affected by this? Okay, let me ask you, what part of the heart sends out blood to the lungs to go get oxygen? The right ventricle, right? It goes, right atrium comes from the body, goes down to the right ventricle, goes out the pulmonary trunk and pulmonary arteries to go get the blood oxygenated before it can come back. So if you have pulmonary arterial where the arteries and capillaries of the lungs have high pressure, high resistance, hypertension, that backs up the heart. It's like a kink in the hose. Before the kink, that's where the pressure is going to go up and build and kind of hypertrophy and get large. So this ends up causing this enlargement and failure of the right ventricle. It can't work against that load, that pressure. Okay, and that can be really, really serious. A lot of these, all of these can lead to death. So if they're not treated and they progress and get worse, they can lead to death. So congestive heart failure, pumping efficiency is reduced, cardiac output is not enough to maintain blood flow that the body needs. It's due to a lot of different things. So these are just all these aspects of heart disease, from atherosclerosis to congestive heart failure to myocardial infarction. Hearts due to congenital defects, so arrhythmias, congenital defects, even things like valve defects. So a problem with the mitral or tricuspid valve or the bicuspid valve. It can be due to a previous myocardial infarction where there was damage to the heart in a specific area. Hypertension, that means high blood pressure, sort of chronically. Aortic valve stenosis, hardening of the aortic valve, that semilunar valve. So blood can't get out the aorta well enough and it kind of backs up in the heart and causes the heart to get bigger. Or disturbances in ions like potassium and calcium. Those are key for muscle contraction. The heart is a muscle, affects the heart. Left side failure, it results in pulmonary congestion, so buildup of fluid in the lungs, and edema, so fluid spilling out into the non-vessel spaces. Shortness of breath or dyspnea happens, coughing. This is left side congestive heart failure. Right side congestive heart failure causes congestion and edema, so building up of fluid in the vessels and then fluid leaving the vessels and going out into the tissues, or edema out in the body. So in the legs, in the limbs, it's typically in the limbs you get swelling and edema. So that's left side heart failure, that's right side heart failure. And that's what they sort of result in, the different types of edema. A lot of people talk about arrhythmias, and arrhythmias are kind of common. There's several percent of people, I can't remember what the exact number is, but there's a lot of individuals that have some type of arrhythmia, as well as other animals. Lots of animals have arrhythmias. Variation from the normal heart rhythm, so it's irregular. And often arrhythmias or irregular heart rhythms come from valve problems. Again, this can be due to a congenital, born with valve problem, or a valve problem that happens throughout life. Arrhythmias can be serious because they can result in ventricular fibrillation. Okay, that's where the ventricles are not beating in a coordinated sequence. So there's rapid random firing of those electrical action potentials in the ventricles. So there's firing in the ventricles, and it's not in that nice coordinated way where we talked about the conduction system. So the conduction system is basically crippled, what we call it. It's not working effectively and getting the ventricles to spread and then contract in the usual way. Ventricular fibrillation. And this is really a common cause of cardiac arrest. The heart is basically now kind of seizing, and it's not able to keep the blood flowing and the blood moving in a normal conduction cardiac cycle. So common cause of cardiac arrest. To get fibrillation, so the random firing side of the ventricles and they're not beating and conducting in a coordinated way, we can use you can use electricity. Basically, you can shock and defibrillate. Have you guys seen, your little pads, a lot of the medical shows have these. They say defib. You're defibrillating the ventricles that are having random firing because their conduction system is having a problem. So you're basically giving voltage and trying to give electrical energy to the heart to get it back in synchrony, to get it back conducting the right way, and zipping down SAAV, bundle His, bundle branches, Purkinje fibers, and get the ventricles back in sync. So they're not doing this random electrical firing and kind of fibrillating. So using that can actually defibrillate or sort of fix the problem if the individual's having a cardiac arrest. So the ventricles don't beat together in synchrony, and that's a problem. You have random sort of contracting and beating out of their normal synchrony. Other types of arrhythmias can cause atrial fibrillation. That's where the impulse is the action potential circle in the atria, stimulating the AV node, that little second autorhythmic little patch of special cells, and they actually keep stimulating the AV node. So now the impulses are kind of just circling around and doing whatever they want. They're not doing it in a coordinated way. And this can, if atrial fibrillation happens, where the atria are not in sync anymore in the normal pattern, and they're contracting sort of in their own way, this can make clots start forming in the atrial blood because the atrial blood is not efficiently contracting and going down to the ventricles. It's actually starting to pool, and this random firing that's happening and stimulation of the AV node is preventing them from contracting in coordination. And that can lead to strokes. If a clot accumulates in the atrial blood, right, and then goes out eventually and goes somewhere, it can wind up in the brain or the pulmonary system or to the heart coronary vessels themselves, right? If it's in the brain, it leads to a stroke. And that's from this fibrillation of the atria. And this usually occurs in things characterized by anxiety, fatigue, so real tiredness, shortness of breath, dyspnea, palpitations, so the heart, you feel the heart palpating, sort of palpitations, like irregular beats individuals feel. It almost feels like the heart is beating out of the chest, sort of. If you've really, really done high intensity exercise, sometimes you feel like that, like it's you have. But it's a very distinct, irregular rhythm that's noticed. There's a lot of congenital heart defects as well, so those are diseases. Something I didn't mention, and it's really interesting, so myocardial infarctions or cardiac arrest where the heart stops beating like that, that is really common. The number one situation where sudden cardiac death occurs is among high intensity athletes. I don't know if you guys are aware of that. And a lot of it comes from sometimes there's a congenital problem already that the individual didn't know about, or it's a problem with the conduction system, or it's just overworking the heart where it hits a point where cardiac arrest, sudden cardiac death. And the highest rates that I know of occur in really high performance athletes. So it's rare, but it happens, and that's the group, that's the population or the demographic that it happens in. But the other ones are more related to sedentary lifestyle, diet, eating a lot of high fatty saturated foods, and cholesterol, and also genetics are a part of that, and high blood pressure. So lifestyle, blood pressure, circulatory factors, diet, and exercise really affect a lot of the other ones. But some people can be in perfectly good health and they can have sudden cardiac arrest. And individuals that are born with it, obviously that has nothing to do with lifestyle or what you eat or how much you exercise or whatever. These individuals are born with these congenital defects, often tracing to the second month of development. And remember, by the end of month 1, the heart is in kind of near final form and it's starting to beat, but it gets larger and it gets more, elaborate, and it really starts to continue further in month 2. So ventricular septal defect is the most common, so there's a septal defect between the ventricles, and then there's 2 types. There's inadequate oxygenation of blood getting to the body, or the ventricles are laboring and there's too much work for them to sort of work again, so it makes it hard on the heart. This occurs in 1 in 500 births, this ventricular septal defect. This is bad because there's a hole in the septum, and now the blood that's deoxygenated or low oxygen, poor, right, versus oxygen rich, that blood can combine and go back and forth. That's not good. So the way the heart is separated, it's top and bottom, atria ventricles, right, to do the cardiac cycle. But the way the blood is separated is oxygen poor on the right, oxygen rich on the left. You don't want to mix those things up. The other part is coarctation of the aorta, basically a narrowing of the aorta, so the vessel that takes the blood out to the body. This happens about 1 in every 1,500 births, so this is more rare. My little niece was born with this, and she had to have immediate surgery in the first 24 hours of life. She was blue, purple. They could see her tissues were not getting oxygen. She was not getting enough oxygen and nutrients out to the tissues, really turning purple. Okay, and they said, oh, she had to have immediate heart surgery. Doing great, she's fabulous now. But she had coarctation of the aorta. And then 1 in 2,000 births is even more rare. It's called tetralogy of Fallot. It's multiple defects. They've got the septal defect. They've got a narrowing of the pulmonary trunk. So there's a lot of backflow and mixing of oxygenated and deoxygenated blood that can be really, really difficult to deal with. Surgically, these have to be taken care of because the individual can't persist. This was my little niece, Alex, and she was born with that, with coarctation of the aorta. Now she's like, oh my gosh, she's so old now. She's like a teenager, a big giant teenager. This picture's old. She was like 8 in that picture. We'll do this next time, but I have a little case study. I think we're out of time. Yes. So we'll just do this next time as a group, and then we're already going to go into the next set of material. And I'll be working on the study guide. I'll probably email it to you, and I'll put it up on Moodle, so you can access all that stuff on Moodle. Take a second to write on your card, write down what you got, what you didn't, or any questions, and then I'll give those back to you on Monday. Okay. Yes. Yeah, come back to that later. Yeah, so we'll finish the blood. We'll finish the blood and we'll look at the blood vessels, and then we'll go into the next section. Oh, and I should also remind you, Monday we're dissecting eyeballs. So we're doing eyeballs, and then we're going to get into the cardiovascular system after we dissect that. It's fun.
Thank you.
Thank you. Yeah, have a good weekend, you guys. And get your studying in.